Low-income seniors have Medicaid. High-income seniors have a wealth of options. So what happens to those in the middle? Caroline Pearson is the Senior Vice President in Healthcare at the National Opinion Research Center at the University of Chicago. She conducted a study of middle-market seniors.
The sad reality is there's very little today happening in terms of helping middle-income seniors. The attention all goes to low-income seniors and high-income seniors, and the folks in the middle really are left to sort of muddle through with their families and the unpaid care that they can get from their community.
Pearson says the U.S. will see a massive increase in middle-market seniors by 2029.
That's projected to grow from about 8 million individuals today to 14.4 million in 2029.
Executive Vice President and Chief Public Policy Officer at AARP, DEBRA WHITMAN, says a study they funded by the Kaiser Family Foundation shows the cost of aging may skyrocket sooner than you think.
By 2030, about half of your Social Security check will actually go to out-of-pocket healthcare costs. That's your premiums, co-pays, long-term care. So you're not going to have as much money in retirement because healthcare costs are growing so much.
And while some seniors can turn to Medicare for their health, professor at the University of California, San Francisco, and a fellow on the House Ways and Means Subcommittee on Health, Carrie Graham, says it fails to cover another key human need.
Medicare, which is a universal health care program for seniors, doesn't have any sort of services for long-term services and supports or housing.
Many of us who live in more privileged environments think, oh yes, people can go to assisted living. And when you start to line up the amount that folks have saved against the annual costs of those facilities, you realize they're just out of reach for the majority of people in the middle income.
Insurance company Genworth helps families plan for the cost of assisted living facilities. In its cost of care survey, it found the average cost of an assisted living community is about $48,000. The company has a tool on its website to help families understand the cost in their communities. Senior Senator from Illinois, Dick Durbin, has introduced legislation that would increase the amount of money for family caregivers. But there is currently no legislation helping seniors deal with the rising cost of housing. Reporting for the Medill News Service in conjunction with the Illinois Channel, this is Daniel Grimes in Washington.